everyone, welcome to another UAB Women in Surgery Spotlight video. My name is Leanne Jong, and I am a current second-year medical student in UAB's chapter for the Association of Women Surgeons. Today, I have the pleasure of introducing Dr. Lima, who's an associate professor in the Division of Plastic Surgery. Dr. Lima, thank you so much for joining us for this interview today. Could you tell us a little bit about yourself?
My name is Maria Lima, and I am an associate professor, like you said, of plastic surgery at UAB. And I do a lot of breast surgery. I do a lot of body contouring surgery, and a lot of overall. I say the beauty side of plastic surgery. You know, the plastic surgery has a lot of functional plastic surgery as well. But I like to be more of the not only cosmetic, because I do a lot of reconstructive plastic surgery too, but the reconstructive plastic surgery, let's say breast reconstruction, massive weight loss surgery. After patient had massive weight loss surgery, they need like excess skin removal. I do also facial plastic surgery, both reconstructive and cosmetics. And I do also Botox fillers and rhinoplasties, reconstructive surgery of the face. So yeah, that's what I do.
Thank you so much. Can you describe your journey towards plastic surgery and how you got interested in this surgical field?
Well, I'm originally from Brazil, so I did my training in Brazil from 2004 to 2009. Those are my general surgery and plastic surgery residencies. My medical school is also in Brazil. After I completed my residencies, I practiced there for a couple of years and came to the United States for 2 pediatric and craniofacial fellowships. After that, I went back to Brazil and practiced for a couple more years. And back then, I decided to move back to the States, so I went back and forth a couple of times. And then I pursued reconstructive microsurgery fellowship, and after that that was at the Medical College of Georgia, and after that they hired me at the Medical College of Georgia, and I stayed there in faculty for 5 more years, so a total of 6 years at the Medical College of Georgia. And after that I came to UAB last year, so I've been at UAB for it's going to be 1 year next month, so total of 1 year in Alabama.
You've had a lot of training in a lot of different places. That's great.
Yeah, and I decided to be a plastic surgeon. You probably, want to know how I decided to be a plastic surgeon. It wasn't something that came, until probably like close to the end of my medical school. It wasn't something like, a lot of people, I always wanted to be a plastic surgeon until when I was like 5 years old. It wasn't something like that. I don't have any physicians in my family. It was just me. So I was thinking, what am I going to do? In Brazil, medical school takes 6 years. So it doesn't have college and then medical school. It's all combined. Since high school, you have to do 6 years of medical school, college and high school, college and medical schools together. So when I was in high school, I had to choose pretty early what I wanted to do. So I chose to be a doctor when I was probably like 16, 17 years old. So it was pretty early that I had to choose to be a physician. And I was still kind of like questioning what I wanted to do or not. So I decided to be a doctor early, but, it was more like exclusion things, but I really wanted to be something that had a lot of options. And I liked to be a doctor, but I didn't really know what to be a doctor was, because back in Brazil, in the late 90s, I didn't have as much opportunity to shadow a physician like you guys have nowadays, and to really know what a lot of specialties are. So I was kind of blind into medicine. So I was lucky that I loved to be a doctor, but I didn't have as much opportunity. And then once I was in medical school, when it was getting later, I knew I liked to work with my hands, and I knew I liked the details of surgery, the details of plastic surgery. So it was when getting closer to the end, I was really liking plastic surgery, but at each rotation I liked, when you're like in the rotation, I'm like, I like this, I like that. But it was getting closer to the end, I was kind of deciding between maybe dermatology and plastic surgery, but I really liked working with my hands. And I was like, dermatology, I don't think I have, hands-on enough, and I don't think it's invasive enough for me. So I liked surgery. So I was like, I think I want plastic surgery. So that's how I decided for plastic surgery.
That's awesome. And it's great to hear about your experiences in Brazil as well. I feel like that's very fascinating and definitely unique. Have you had any challenges as a woman in a surgical field? And if so, how have you overcome them?
We always have, less and less over time. Especially in plastic surgery, it's a field that's dominated. It's having more and more women over time. Like if you look at the number of plastic surgeons, let's say in the residencies nowadays, there's probably half of women or even more than half are women. But if you look at the practicing plastic surgeons, are way more men still. So it's good to know that there's a lot more women coming into specialties. But let's say, my previous job, I was the only woman and my partners were men. Currently, the majority of my partners are men, and there's only me and another woman in 7 men total. So there's always challenges in being women. But I think most of the challenges are subtle. There's nothing like very, very aggressive. How do you overcome? I think it's important that you kind of try to stand up for yourself. But always in a subtle way. I don't think you should try to be super aggressive back, because then you kind of make enemies along the way. I don't think it's worth it making enemies. I think you have to kind of set up your path in a very, I would say, for example, there are things that you should start doing from the beginning, which is always being kind to people. That helps, and respectful to everyone since the beginning. But there are things that you can always do. For example, I think since the day you graduate from medical school, you should always introduce yourself by doctor, by your first name. That kind of helps, because you're going to be introduced by Leanne, and you're going to see your partner be introduced by Dr. blah, blah, blah several times in their life. So it helps if you introduce yourself by, Dr. blah, blah, blah. So when you see that happening, you just kindly say, I'm Dr. blah, 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 because you are, you carry that. It wasn't easy to go work all these years and, have that big paper that says, you're Dr. blah, blah, blah. You carry the MD. You're not only doctor, the MD, that, it's so hard to get. So you earned that. So why not, But I think just being kind, respectful to everyone, and remember that a lot of times people are those things that people say, and those challenges that people do, that's the things that the microaggressions that people will do to us. They're not necessarily on purpose. Sometimes there are things that people carry from different generations. So I think just trying to hit back an aggressive way doesn't help us, because I think politely trying to explain why that shouldn't be done is the best way to do it. Because people sometimes they don't even know what they're doing. They just carry that from their fathers, their grandparents, and they're not even seeing what they're saying. So I think that has to be changed, but in a nice way. That's how I think it should be done.
I think that's great advice, not just for women in surgery, but everyone in any field. So thank you so much for sharing that. Do you have any other advice that you would give to female medical students when exploring surgical specialties?
I think don't be afraid to, don't be afraid, if you see, don't be afraid overall, of challenges. I'm not going to be able to get it. I'm going to give up. I'm not good enough. I think like the sky's the limit. There are things you can get that, if you really want something, pursue your dream and work hard for it. Find a mentor, find someone that you can inspire you, and ask for advice, ask for mentorship, work hard for it. And like I said, be respectful always to everyone, not only to your attending, to your coworker, to like the cleaning lady, because you never know this person tomorrow, or even today, people talk, people say, and your reputation is all you can carry. Everything else you're not going to take with you, but whatever you go, the only thing you carry with you is your reputation. So I think like being nice and respectful to everyone is your character, your reputation is everything you can carry with you. So I believe in yourself, work hard, and be respectful and kind to everyone. That takes you a long ways.
Yeah, I definitely agree with you, and that kindness and respect to others takes you a long way. Our final question for you is, how do you balance your professional life and personal life?
The first answer is I think we never balance enough. I think we're always trying to balance more and more. We feel like we never balance enough. I'm trying to learn to say more no's. I think I used to not know how to say no's in the past. I used to always say in my first job, people would ask me for everything. Oh, do you want to do this surgery? Yes. Blah, 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 blah. Yes. So now I'm trying to learn how to, do more no's, say more no's, and do more of what I like at work, and try to set more boundaries and be a little bit more protected of what I don't want to do, which is too hard since I'm still new to UAB, but I'm doing a little bit better than in my previous job. And outside work, I'm trying to stay off my phone. I do. I'm honestly don't when I get home, and I'm not on call, of course. If I'm on call, I can't. But if I'm not on call, I really put my phone on my bedroom and leave it there. And I try to stay with my kids, after work time and on the weekends. And it's just once in a while I will check it. I really try to protect my nights and my weekends. I try to exercise a couple times a week to protect my back, because I had some back pain. Not every day, but at least enough to not have that pain. And I try to take a trip or once or twice a year with my husband. I try to take my kids to ice creamery once a month or twice a month, like once in a while after school, and go to their activities when they have soccer games and things like that as much as I can. Once in a while I go take their, have lunch with them at school and do small things like that. I don't balance as much time for myself. I should do a better job of that. I try to prioritize my kids and my husband. More my kids, actually. I should do better job with my husband, but I should do some and not much with myself. I should do more with as far as like finding friends and going for a coffee or things like that. I should do a better job with that. So, yeah.
Well, we appreciate everything that you just said, and thank you so much for sharing such valuable guidance and advice, and for being such a great mentor. We just appreciate hearing from you for this interview.
Thank you so much for having me. I really appreciate being here and being able to help. And I'm available for anyone that would like to contact me. And I'll be happy to help you guys. And if anyone want to contact me individually for mentorship, I'll be happy to help you guys.